Over the weekend, we confirmed another case, or the first case here in Mecklenburg County, among a resident of Mecklenburg County. That resident is home and isolating. And we provided more details about monkeypox in the press release, so I won't go through those details on this call. But certainly we are here today to answer any questions you all may have about it, specifically monkeypox, what people should know. The biggest message is obviously we're encouraging everyone in the community, if they have any symptoms that were flu-like symptoms, along with the swelling of their lymph nodes or a rash, to contact their medical provider. And to get in touch with their medical provider who can then follow up as necessary. Just a little bit of high-level background on monkeypox. It is not a sexually transmitted infection. It spreads most commonly by skin-to-skin contact. Individuals typically have those symptoms I just described, flu-like symptoms, swelling of their lymph nodes, or a rash of some sort that eventually fills with fluid and scabs over. It can be confused for STIs like syphilis or herpes, or it might be confused as well for chickenpox. So it's important, given the fact that it is, again, its presence here in the U.S. is increasing. It's important for people to be on the lookout. The infections do remain relatively rare. I believe in the U.S. there are just over 200 confirmed cases, but certainly we know that may be an underestimate of how many cases are truly here. We also encourage our medical providers in the community to be on high alert. We've sent out a number of communications to those clinicians. We also have had a number of preparatory webinars and trainings, and our team has been preparing for the last month or so for this to occur. And as we're here, I'll take a moment just to say thank you to all of our public health team who have been working so diligently to prepare our community for when monkeypox made its arrival here. And certainly we are working every day to continue those preparations in the event that we have additional cases. Our communicable disease team has worked diligently over the weekend to make sure we identified and contacted any close contacts of the case and informed them of their potential exposure, as well as have worked to ensure, our clinical team has worked to ensure that we're able to vaccinate as needed for any of those close contacts. So with that, I'll take a pause here and see if there are any questions from the audience. I think any other details you guys can read in the press release.
First question today is from Claire Donnelly, WFAE.
Hi, Dr. Washington and Joy. Thanks so much for doing this. So I wanted to see if you could give a little bit more information about how the county has been preparing for possible additional cases. And then I wanted to ask if you guys have the monkeypox vaccine and any plans to administer that if necessary.
Sure, yeah. So there are a whole host of activities that have been underway within the health department to prepare. That includes obviously preparing our clinical services team under the leadership of Glenda Dancy have been working to prepare in the event that a patient presented to the clinic with symptoms similar to monkeypox. As you know, we do quite a bit of treatment of sexually transmitted infections in our STI clinic. And so it was important for us to make sure our team was prepared in the event that there was a patient in our care. Also, we've been working to inform and educate our community providers through a variety of mediums, both webinars and written communications, to be aware of the signs and symptoms. We've also established an incident command structure within the health department to help us manage through this work as we typically do in these kinds of situations. As well as convened our partners at the healthcare systems and other key players in the community that may be a part of any kind of response efforts. The second question you asked was related to vaccines. There is not a monkeypox vaccine specifically, but we are able to use vaccines that are typically used to prevent the spread of smallpox. And so our team is also preparing and are able to administer the smallpox vaccine. We are waiting on additional supply of that vaccine to be shipped to the county so that we can have it in stock here. But certainly at this time, the CDC is not recommending any community level or population level vaccination efforts. So we're prepared and are ready to vaccinate close contacts and individuals who may be exposed in an occupational setting. Joy, I don't know if I missed anything, but if anything you want to add, you can feel free to jump in.
Hi, Dr. Washington. It's Kendall Morris with WCNC. I just wanted to ask if you have been able to pinpoint exactly how this person came to have monkeypox, or if you know.
If I miss anything, but anything you want to add, you can feel free to jump in.
Hi, Dr. Washington. It's Kendall Morris with WCNC. I just wanted to ask if you have been able to pinpoint exactly how this person came to have monkeypox, or if you know maybe who they got monkeypox from.
Thanks for the question. And yes, we have been able to identify the likely source of transmission. And so at this time, we are not concerned about community transmission here in Mecklenburg County. We believe we've been able to trace it to out of county individual out of county. And so that's what we have at this time in terms of information about that.
Hey, it's Morgan Francis from Queen City News. Last week, health leaders announced the first case in North Carolina, but they didn't say specifically where it originated from. Is this that first case, or would this be considered the second case in the state?
Thanks, Morgan. I believe this is the second case in the state, but I would refer you to the North Carolina Department of Health and Human Services to confirm that.
Hey, Dr. Washington, Brett Jensen. You talk about smallpox. There's a lot of similarities with chickenpox. Can you just break down why this is more important, if at all, than chickenpox or smallpox, or if it's relatively the same and it's just something new? Is there like a grave danger and people should be concerned? Can you just, people hear monkeypox and they start freaking out. So can you just sort of break things down on why it's important, or if it's more dangerous, not more dangerous, whatever?
Sure. So typically, I will say monkeypox is typically not a severe illness. It can be severe in certain populations, specifically younger people, older adults, people who are immunocompromised, patients with HIV, for example. There are groups who it certainly pose a greater threat to. In general, though, it is typically not a very severe illness, and it's what we call self-limiting, in that it tends to resolve itself in about 2 to 4 weeks without any kind of medical intervention. Typically, most of what we provide to patients with this are just sort of supportive care that might be needed to deal with the uncomfortableness of the symptoms of the virus.
Next question is from WSOC TV.